Hello everyone, welcome back to Digoxin channel. Today I would like to discuss about the my favorite clinical pill, which is known as the T inversions on EKGs. So let's dive into it. Okay. All right. I'm going to minimize my window and let's see. So okay. So as you already knew, you all have the profound idea and the profound knowledge that T inversions on EKG is always equal to myocardial infarction or myocardial ischemia. But that's true. That's 100% true. But this is not always true. This is not the only one, the only diagnosis we should think about. According to my experience and according to my perspectives, I have profound idea about the T inversions on EKG. So let's see. If it is in the let me minimize my window. If it's in the T inversions is mainly on the lead one and AVL and V5 and V6, it's gonna be T inversions. I'll repeat it again. If the T inversions is on the lead one, AVL, V5, and V6, this is left ventricular hypertrophy, which is a left ventricular strain pattern. Okay, this is one of the diagnoses. This is the first, and the second is that if it is like deep T inversion, very deep T inversions on the V2, V3, and V4, and V5, and V6, and this is we're gonna think about the hypertrophic obstructive cardiomyopathy. um and then and then and the next we what we should think about is that whether it is electrolyte anomalies. So we're gonna take a look at the potassium. If if the potassium is low, there can also be the T inversions on EKG. Or there's a widespread T inversions on EKG, but not as deep as those in the left ventricular hypertrophy or no, sorry, not as deep as the T inversions on the HOCM, hypertrophic obstructive cardiomyopathy, or specific pattern like the left ventricular hypertrophy. This is one kind of things that we need to be considered. This is the third, and the other is the downsloping SC segment depression with the T inversions, and we're gonna think about the same kind of medication. The particular medication is known as the digoxin effect. Digoxin is an antiarrhythmic which is used in the cardiac arrhythmia, so we gotta think about it. And this is the third, and the next after the electrolytes and after the medication, what we need to think about is that we need to think about the the widespread uh non-specific non-specific T inversions throughout non-specifically throughout all leagues can also be anemia. So we're gonna think about the anemia. We're gonna check hemoglobin, and if it is if it is need to be corrected, we have to correct. And then we need to recheck the EKG if the hemoglobin level is replenished. Yes, and this is the other differential diagnosis we need to be considered. And the and next thing that I want to think about is the T inversions in the EKG is as kind of a I don't know specifically about the exact mechanism between these correlation between the correlation between these T inversions and the the neurological problem, but the T inversions on the EKG can also be associated with a condition called subarachnoid hemorrhage. So we need to think about it. And the next is the T inversions on EKG. We need to think about the pulmonary embolisms. Pulmonary embolisms is a kind of a problem where the black clot in the in our from our leg, like the vein thrombosis travel along the inferior vena cava and the superior vena cava, and then clogged in the pulmonary artery, and then that is the clogged in the yes, yeah. So pulmonary embolism, pulmonary embolism. So and then the next thing we're gonna think about from T inversions is T inversions, and we usually think that T inversions inversions and EKGs is always abnormal, but it can also be found in the normal variant. What kind of normal variant? These are the we can found these T inversion not specifically and shallow T inversions of on EKG on younger individuals, which is known as the persistent juvenile T-wave pattern. And the other normal variants we can found in the what kind of individual is African American. African American, we can find the T inversions and T inversions on the EKG. And the next abnormality that can be associated with the T inversions on the EKG is the myocarditis. So we need to think about it. So